Greetings, everybody. Welcome to LunaSpeaks. This is Shaina Levee. I'm Shaina Levee, and with Birth Love Family, LunaSpeaks is our live video recording where we take you into the lives of Vermont-based birth and family professionals, just to get the word out about all of the amazing services that are available to our community focused on holistic health and wellness. And I'm here with Dr. Erin Sepic. And she is a chiropractor and a kinesiologist. Her practice is Synergic Health, and she's based in Richmond and in Shelburne. Hi, Dr. Erin.
Hello, thank you so much for having me. This is super exciting.
Absolutely. So we were chatting briefly before we started recording about some of the changes that are happening in your practice. And well, because you're pretty well known amongst the community, I think this would be a great opportunity to share what some of those changes are.
Absolutely. I recently have departed the largest insurance network in the state, which is a big decision. And I will probably, not Medicaid, but I will probably be out of network for almost everybody else within the year. Part of the reason is just the onerous compliance issues with documentation and coding and billing. As a chiropractor, I'm held to chiropractic standards, and of course that's great if that's all I did, but it's not. And a lot of what I do is either not a covered service or not covered for the population that I'm doing it for. So if a 3-year-old, like a 10-year-old came in saying, "Mom, my neck hurts," I could bill for that manipulation code, that exam, all that stuff. But if a 6-week-old comes in and can't turn his head to the left, I end up having to fight with the insurance company saying, like, this is obviously a case of torticollis. The kid's looking at me like this, but the amount of documentation required in order to remove the liability from me in my office and still not get covered for, something like craniosacral therapy, which is a lot of what I do with infants. It's just a massive distraction from the quality of the engagement with parents and with the patients that I have. Eventually just became too much for me. So in the last, I don't know, it's been 4 months now, almost, is that possible? Going into month 4 of, I'm going into month 5. Oh, it's been incredible. It's been absolutely incredible to sit down with people. For the most part, I'm seeing cash patients. And since torticollis is one of the only things I could bill for before for my infants, and I see a ton of infants who are colicky. I see a ton of infants who are latching disabled, and a lot of companies just don't want to pay a chiropractor to treat a TMJ cranial issue. Cranial adjusting is not covered in any form by anyone in the state of Vermont. So it's, now I just get to sit down and connect with the parents and connect with this child, and within a few quick questions, I can ascertain what's going on there. And, where I focus a lot in my practice, other than super gentle contacts and ergonomic training, like helping understand how they can that infant, is really giving them all the homework in the world that I can. So when parents are really motivated, I have parents come from New York and parents come from New Hampshire. So it's really nice for me to be able to write them we talked about this, we did this. If you need this, give me an email and I'll send you a quick video if you forget, or if any, it's just so wonderful to be able to do what they need and not have to think about it and think at all about covering my butt. It's been wonderful. So it's been a big shift, and I'm also able to do a lot more energy work without, I can talk to people about it, like patients that are grown or older children or parents. But it's something I don't really have to consider because it's all part of my cash fee. So it's amazing.
Congratulations.
Yeah, it feels unbelievably liberating. It's just like healthcare should just be healthcare. I have these skills, you have this challenge. I can apply whichever skills make the most sense to this challenge, as opposed to the filter that gets that trims everything off on the way through.
Yeah, absolutely. That makes perfect sense. I mean, I can see that it's like those companies trying to control the information so that it kind of ends up limiting your scope of work based on their need to control and file and categorize. So how, it sounds like you're able to do more, and what's the benefit of people paying out of pocket?
Well, I think I can do more, but there's also, I guess, the benefit of me having that enormous bandwidth in my mind freed up is that it arrives with like a much higher degree of presence with, and as you know, you can't fake it with babies. If you're distracted or fearful, or your kid is, has been screaming for 3 weeks straight and nobody slept, the Blue Cross isn't going to pay me to do anything about that. Like, that's not the bugger. The challenge about this whole thing is that it's often well within my scope of practice, but it doesn't fall under covered services within the network, which is what's super frustrating. But yeah, I do have an advanced degree in prenatal and family practice and infant care. And I've been studying this since my last year of grad school, which was 15 years ago. So it's been a focus of mine since before I was in practice. And yeah, it's fun to have conversations every now and then with a peer-to-peer with Medicaid or something, because I get to explain to them, this is actually well within my scope, and this is something I treat a lot, and I should only need about 2 or 3 visits, and we should be good with this particular case. So it's just a challenge, because not just a lot of parents, but a lot of other practitioners also don't understand that chiropractic can be incredibly effective and gentle and pleasant for everybody. So
Yeah, I think that people often just think of manipulation, physical manipulations when they think of chiropractic care. But I mean, you're not going to be doing that with infants or even young children whose bones are still developing. So maybe you can give us some insight for those tuning in who haven't really come across Erin's work before, what you do and how you do chiropractic care.
Right. Yeah. There's a big spectrum of chiropractic, and that's simultaneously the source of our greatest strength and our greatest weakness as an industry. The weakness part shows up when someone, usually an adult, who has been to a chiropractor or been to 2, and like, I tried chiropractic twice, it didn't work. That chiropractic is like this. You might have like hit here, but like never got what might have been way more aligned with what your body needs and what your nervous system needs. So that's the weakness part of it. And the strength of it is that, you probably haven't, like, you've tried chiropractic, but, I get that all the time. Like, I've seen chiropractors forever and I've never got work like this, or I've never felt like this, or I've never, like, you're talking about a whole bunch of stuff that nobody's ever asked me about. Like, what, how is this still chiropractic? But I think the industry is very focused on the nervous system as the brain reads the body through the spine. So it's all about removing as much interference as possible. And I think probably where I differ, or where I depart from that main convention, is that I approach things really holistically. There's a lot of, whether with kids, it's becoming more of an issue with kids now, unfortunately, because of the devices that we're using. And there's so much neck flexion in youth now, not even pre-device, but because there's less movement and less physical education in the school systems, we're actually, this generation is at very, very high risk for not developing a proper cervical curve, which creates all kinds of issues neurologically and airway-wise in the future. So normally I'm not talking about like ergonomics and movement that much with little kids, but these days I finally am. But if someone your age was to come into my office, we're talking about, now that we're cash and I could actually, this could save you 10 visits with me if we could eliminate this food that you're sensitive to. It's creating all this inflammation in your joints. Of course, it's going to land in your worst joints, but if we could just remove this, patients are always reporting that they haven't felt that good in 10, 20 years. So there's nutrition, there's a lot of movement, education, especially ergonomics, like stuff you do all day, particularly with my moms and my dads. Just as simple as like how to hold a child. There's 10 different ways you can hold a child, but how do you hold the child in a way that's ergonomically best for their body and also doesn't bust you? there's a lot of just really simple information that I can give people. And I'm going to start putting it into online courses and YouTube and just throwing it out there, because these are things that you don't really need to be in my office to learn. So there's a lot of ergonomics, nutrition, movement, definitely spinal stuff. And if you were to bring me an infant, getting back to your question,
yeah,
certainly young children as well, but there's a lot of different ways to influence the nervous system and the tone of the spinal muscles without putting any significant force into it. And I didn't even understand this really until probably a few years into practice. And it was probably after my first experience with craniosacral. And yeah, I'm trying to think of the age, and the age is relevant, not relevant. You can have one 6-year-old boy who's 3 times the size of another 6-year-old boy, right? Mm-hmm. One child might be ready for a structural adjustment, but he would know exactly what that is. He would have seen it before. He would get my clear consent. He would get a little trial, like force, like this is what it's going to feel like. We're going to do this. It's going to be so fun. And it's super consensual. Parents are always included in the whole thing, but that's definitely later on. So it's very light tonal work and resembles more like a craniosacral therapy session. I add the latching and the airway education and all the cranial work and the neurology. So that usually isn't part of a traditional CST session. That's just a little bit more of it in a clinical setting. So I usually am watching the parents for where's the threshold of this is too much information now. Can we try to, depending if anybody slept, I might not even mention what I want them to do at home. Other than basic holds. Nothing like seeing a parent almost fall asleep sitting on a ball with, the other baby while I'm working on, about like the first thing we do is support the parents. Like, is this the sole issue here? Or how can I support you? And then we work with the child. So yeah, some infants come in very, very upset. You're talking about distress signals and postures and infants and whatnot. But if it's a much more functional issue, like a latching thing, like the child's perfectly happy and everything's great, but can't nurse for beans, then it's just not a stressful interaction at all. But sometimes if the child's really upset and very, very colicky and has been for a while, I usually go right to work and I just sit down and we get the child very quickly into a position that brings them comfort. And they usually, if they haven't slept, they will usually fall asleep. And then we can talk about what's going on. I'm getting questions, I'm taking notes, but I'm holding this child so that they can rest. And then we'll start the treatment after we've had a conversation. But we're not going to converse and have anything productive happen while this child is. So not a lot of crying in my office. Really, if the child needs to tell us a story, of course, we'll listen. But it's very non-traumatic, very educational, and really empowering.
Well, it sounds like you make a good neighbor.
I've got a bunch of girlfriends having babies right now, and I'm so excited to be there to do way more. It's so much fun. So fun. It's such a magical time. They're magical little beings.
All right. Well, yeah, let's kind of stick with infants, because this is such an overlooked area of care.
It is, unfortunately. There's a you know this well, but and our pediatricians are brilliant, our ER docs, there's no question. But that's when something is really, really wrong. Like when you need an intervention, when you have a child who's deeply just uncomfortable in their body, but they're not blowing any blood tests. There's not any acute measurable, pathology. We don't have, in our medical system, we don't really have a mainstream option for that. I don't know how many of my parents, what percentage is a very high percentage of parents who come in saying something like their doctor told them this was normal, not to worry about it. It's been 10 days since the infant pooped. They haven't slept in 4, they just refuse to do X, Y, and Z. It's normal. I'm like, I just usually try to explain that it's common. It doesn't mean it's normal. So it's normal for their practice.
Yeah.
It's not normal, healthy pattern. And, you know, here's what we do about it. So just the functional infant care and case management is, I find a different, you know, you don't come to me when you're, of course, bring your baby in if they have a fever, of course, but you're not coming to me first. You're going to go and like stabilize that. You know what I mean? I'm not an emergency care person.
Yeah. Right.
But the stuff that doesn't hit that bar, all that stuff in here, that's much more what I focus on. So just for a child who, without doing range of motion or without being able to read somebody's tissues with your hands, you really can't get answers. So finding someone along those lines who can actually manually engage with your child in a very gentle, respectful way, reverent way, is a huge gift. And up here, we're doing amazing. But there are good CSTs, and a lot of them practice predominantly with infants and postnatal stuff, prenatal. And they are easy to find on Upledger's website. So if I was stuck in Kentucky somewhere, no offense to Kentuckians, there's a relative vacuum of every, you know, all the services and perspectives and holistic angles and visions really for healthcare that we have here in Vermont. So that's a great resource. I send people all over the country to that website, and I'll have them check out and ask around and see who's good with babies. Because a lot of practitioners who have this kind of skill set may not work a lot with infants. And it may, you know, if it stresses them out to work with one, it's going to stress the infant out. So it's just great to be able to find practitioners who do this work and have felt called this way. And again, the skill set of just being able to touch somebody and to teach parents how to check range of motion, how to strengthen this, and how to what is going to increase their baby's tone, and sleep positions, nurse positions, all sorts of things like that.
I think your approach to, sorry, I didn't mean.
Not at all. No.
Okay, cool. I think your just the awareness that you have about tissue, you use the word tone, range of motion, what you bring to your CST practice from that. I'm assuming that has a lot to do with your background in kinesiology, as well as your background as a chiropractor, that you're able to utilize the craniosacral therapy for infants. Yeah. As a kinesiologist, I learned craniosacral through AK. So I'm not a traditionally Upledger trained CST. The things that I bring to that part of my practice, I think, are that really intimate knowledge of, you know, doctoral level anatomical study and all the physiology around that. And then adding, you're right, the kinesiology is super, super helpful. But I think learning how to feel, like this is something that even with an infant, a massage therapist who is, you know, super gifted with connection and touch doesn't need that level of anatomical expertise to feel a child and what they need. Like there's a point where, and this is tricky when I'm referring somebody in California to somebody else in California. Like you can read all the letters after somebody's name, whether or not they're a DO or a PT or a licensed massage therapist. If they've got CST letters out the wazoo, likely that they very much know what they're doing, but can they connect with an infant? Can they read that without words? So yeah, I bring a lot of sort of different angles to that. I think that's ultimately how I got into my intuitive work, was I was driven there by babies. So I've been studying clairvoyance and intuitive healing for 11 years now. And that, I think, started when I began to be able to connect with babies. It began when I started getting craniosacral therapy. I met Sandy. Everything just sort of like exploded. I was getting all this information and wasn't really sure what to do with it. Every now and then there's something that really isn't physical at all that is stressing out an infant. And being able to understand that and being able to support the parental unit in the ways that are the most effective is, you just can't put a price on that. So having the intuitive training is also really important. But as a clinician, as a young clinician, I was frustrated. Even though I felt like I had so much to offer,
there were times when I wanted more clarity, when I wanted more certainty, and the energy work has given me that, has filled in that gap for me. And babies tell you all kinds of stuff. You just have to learn the language. So I definitely wanted to do that, and I threw myself right down that rabbit hole.
That's awesome. Yeah, I, especially when there's been a trauma around birth, and
Right,
the mom
right.
or the prime or the birthing person has trauma or shock going on, their
Right.
ability to perceive their child clearly and really listen for that nonverbal communication and be able to be
Right.
present with it when they're overshadowed by doubt or depression, anxiety,
Mm-hmm.
stress.
Absolutely.
Yeah, just wanted to put that out there.
Mm-hmm.
So we were talking range of motion a little bit. You were talking range of motion too. Um, so the first time you joined us on LunaSpeaks, which was last year,
Mm-hmm.
you gave this really amazing and very concise, hi puppy, um, explanation of the head turning. Kind of recently, I was caregiving for a 1-year-old, and when she would get into these intensive crying fits, she would
Mm-hmm.
start to do this.
Mm.
And I actually referred her mom to see you, and she had seen you for her first child, so she was familiar. But
Nice.
I've been curious to pick your brain about that and any other signs that we should be aware of.
Yeah, usually there's a it's funny to take a wild flying guess at a child I haven't seen, but what you're
Yeah,
describing,
good point. Yeah.
a spasm of the opposite SCM muscle, which is innervated very specifically through the cranium and the cervical spine. So it sounds like either that muscle might have gotten tweaked in that labor and birth process, which is very common, particularly when there needs to be any kind of leverage applied to the child's head to get the shoulders turned, which we can go right down that rabbit hole of arguing that, but that is a commonly injured muscle. And with that kind of back and forth sort of quivering when they're in full rotation is usually a spasm of that opposite side.
Mm-hmm.
But that's usually a sign of certainly of trauma. If it only happens when she's really upset, then she has done really well. She's healing well, but she's obviously not clear. So yeah, range of motion is one of those things. Even with the sleeping newborn, it's so fun to be able to teach parents that they can. I wish I had a stinking doll with me. I didn't even think about that. But you can, with the child lying face up, dead asleep in your hands, you can actually really gently turn their head to full right rotation. And if they're sleeping and they don't twitch and they don't resist and their limbs are completely limp, great, that's clear. And if you go the other way and they twitch or they make a funny face or their arms kind of flail for a second, then I look at the parents and I say, she might be having a dream. Well, let's try that again. And we do it like 3 times. If it's a fail on the first one, we'll repeat it twice. And if she stops me at the same time, at the same point, 3 different times, there's obviously a block there in her neck. And they can see that. We don't wake her up. She's telling me dead asleep. But I can show them how they can actually do this very gently, very, very gently. And just, is that spine clear? Can you take her into side bending? Do you get any funny faces? Nope. Great. And then there's also, which not really a range of motion thing, but it translates that way. The skin folds in the back of your neck. When you look up, your skin's folds.
Yes, yes.
Sometimes in like toddlers and older children, particularly if they're sturdily built. The goal with the skin folds, assuming the child is neutral, you have to be very careful about this, especially with infants. So if their palms are down on the floor and they're lifting, they just need to be looking straight ahead when you're looking at their neck. So it doesn't matter how many skin folds there are, but you must have evenness. You have to have symmetry. very, very close to perfect. So if you have 3 on one side and 1 on the other, that's not cool. If you have 3, but they're like this, if you're here, that's fine. If you're here, not so fine. So simple things like that. And those skin folds are visible very clearly on the neck, and they're also visible. I teach parents how to scan the sacrum for those as well. The main fold between the gluteal creases are below, and those should be even. But right in between the cheeks, if you gently squeeze the top of their butt cheeks, that fold should go straight up the spine. Again, they're neutral. But if that fold goes up from in between the glutes and goes this way, that's an imbalanced sacrum. So it's fun to be able to like show parents this isn't, I mean, it can look like not witchcraft, but it just looks like I'm hanging out with your kid. It doesn't look like I'm doing it. Like it's so gentle and so subtle, but it's very targeted. So when I can explain to them, like, wow, she wouldn't let me turn her head to the left. And then I do what looks like I'm just hanging out, just feeling her back. And then suddenly she's dead asleep and she lets me go all the way. And like, we're happy, unconscious. Like, isn't that cool? And they're like, well, so it's nice that they don't just have to completely trust me. Like I can show them before and after stuff, even on a person that small. But yeah, that's some of the most fun stuff is like, you're a parent, you can check, if your child falls headfirst off the slide at the age of 5, those skin folds are probably going to be off the next day. like you don't need to check that stuff when you watch your kid like land on their head, but bring them in for a little check. That'll save you quite a bit.
Yeah, time to bring them in.
Right.
Great.
But yeah, range of motion is it's a huge, easy, underutilized, anybody can see it kind of tool.
And is there the going to one side and then straightening, going to the other side? Is there anything specific with, let's see, I think where I'm getting at with that is the cranial nerve.
Mm-hmm.
I find that if I'm going to bed and I turn my head to one side, and then I'll turn my head to the other side and just sort of let the weight of my head stretch and relax this opposite area, it actually kind of puts me to bed. So I wonder if that would also be the case for mothers whose children are having trouble sleeping, or what other kinds of recommendations you have for ones who are having trouble going to bed.
I think, and do you mean going down or passing out?
Not crying and being content with the experience of,
And what age-ish are you meaning?
Infants. I'm still on infant, yeah. But maybe early childhood as well, since.
Right. I think I love this, that you just did an interview with Alyssa Blask as well, because she covers so much of, like I cover like a blanket of which she goes right down the rabbit hole with all these different cases, and learning from her has been amazing as far as a sleep researcher and building sleep pressure in all kinds of ages of small people. But where I can help there is that a child who's not comfortable in their body and a child who's hypersensitive so their resting firing rate of their whole nervous system is too high. So if you're uncomfortable, you're not in rest and digest, right? You're in fight or flight. You can't really drop into that space. So treatment-wise, it's incredibly helpful. And usually, especially an infant, we usually take an enormous elephant of a nap after their first treatment. I'm very careful to not do too much work with a child. They'll always tell me when I'm done, but sometimes children will suck up an enormous amount of treatment, and I will warn the parents they're going to want a nurse like latch and be on you to integrate this, and then they're going to pass out. If they haven't passed out by the time you've left the building, they're not going to wake up when you get home in the car, and that's okay, especially if they haven't slept. So there's a lot of that sort of thing. And then they usually have an amazing night that night, the next night, maybe it's a week, and then it starts fading and they come in for their next appointment. And
yeah.
depending how severe the case is. There's a lot with sleeping, particularly in infants these days. There's an incredible, like a high number of diaphragm torsion. Like there's a lot of different things that happen in labor and delivery, and also just in utero, even if everything is perfect in the delivery part. Partially from the neck and then partially from digestive stress. The diaphragm, the respiratory diaphragm, is a real issue for a lot of kids. So sleeping, particularly on their belly, they will often sleep on their belly, and most parents are only comfortable with that if the child is on them. They'll usually, like this whole back to sleep thing, we're still dealing with the fallout from that, unfortunately, but we were evolved to be belly sleepers. So were our infants. It's the safest place for them to sleep. And of course, we also evolved to have them on us. So that is the easiest, safest way to have them be. But if they're never on their diaphragm, there's two different ways this goes. So if there's enough diaphragm torsion that they refuse to be on their bellies ever, that's a very big problem developmentally. And a lot of parents don't understand this. It's one of the ways in which I kind of look like a crazy person sometimes. I went online to find a special educator friend of mine, some research about like crawling and how important that is as a developmental milestone.
Yeah.
And I found a fantastic vacuum of that information online. Like so many websites saying that it's not a developmental milestone. It doesn't really matter anyway. Like, you know, like WebMD type stuff. Like I was flabbergasted. But if you have a child who has diaphragm torsion, can't lay on their belly or refuse to, no parent's going to leave a child for tummy time if they're like in total trauma, right? That's not happening. But if you can't do that, that child is not going to develop muscles to extend the neck and stabilize the head. And they're not going to crawl because they can't be prone. It's a huge issue. That will be the child who's 80% more likely to be dyslexic. That'll be the child that doesn't get that cross crawl, that whole left to right corpus callosum firing. That's a very big deal. So an infant who sleeps on their belly, even if they're kind of finicky about the timing, that would be one of those referrals that I'd send to somebody like a nurse. But if you have a child who is sleeping on their back, and usually there's some cranial molding issues if that's happening exclusively and if that child won't be on their belly. And sometimes I get parents bringing their children in simply because their craniums are so mismolding. Like there's a giant flat spot here or right in the back in the center. Usually it's off center because there's just enough going on in the neck that they feel best like this. So that left occiput is flattening right out. And if it's really obvious, they can tell that there's something wrong with that. And there's nowhere else to really go for that kind of help. So there are airway issues with sleeping on your back, but there are also cranial issues, just molding issues. So we work with that, and I try to help parents feel safer. Like it's so much easier to have your child sleep on their belly, particularly if they're near you after you've had somebody evaluate their neck, a professional to do this. Like, do they have that range of motion? If they don't, that's my job to restore that. We're not going to put them on their belly if they can't do that. Like, do you know what I mean? So again, with the range of motion, the sleeping usually is due as much to being comfortable in their body and down regulating that nervous system. So if you have, I think a friend of mine, poor guy, his firstborn, I think it was almost 2 weeks before they realized that his collarbone was broken. But this child wouldn't sleep for beans, right?
Oh, wow.
Simple, obvious stuff like that, but that was a marathon of a birth. But if there's anything wrong in our bodies, if we can't get comfortable, we're not going to sleep. So my job is to get them comfortable and ultimately comfortable in the right position, the best position for their airway, the best position for their cranial development, and the best position for their jaw to be able to develop properly. So we all have to work together on that, but I don't have the wisdom that Alyssa has around the research and developing sleep pressure and different ways, like different options parents have to understand how their kid needs to be napping, how to control those types of things. Usually I find that I don't like having her is like freaking cream on top of a Sunday right now, because it's been something that I often haven't needed that support with, but when I do need it, I don't know what to do. Like I don't have that information at my fingertips. So it's been wonderful to have available, and each of us can help people on our own from different places, and it's just such an amazing resource to have for my parents, for kids of all ages. It's been wonderful.
That's,
Did I answer your question about sleeping?
yeah, I think so. And that
Okay.
that is wonderful, and just a reflection of that village that's
Yeah,
available
yeah,
in our
so cool.
community, and how awesome Vermont's birth and family community
It
is.
really is. It's incredible. And she's lucky. I'm jealous about this, and I can support people remotely, of course, in lots of different ways, education-wise, but IBCLC's taught me this, actually, lactation consultants. I have several who work remotely, and they do Skype sessions, and they can tell all kinds of stuff from watching the child nurse and from asking questions. But the great thing about someone like Alyssa is that she can help people in Germany. She can live the Vermont dream and help people all over the place because of the nature of her work. And as a chiropractor, that's what
Yeah.
so.
Well, it sounds like you're going to be developing some courses. I hope that you
Yes,
do that, because um, it is really invaluable information that you have to share. And no matter where in the world you are, you can still learn how to identify some of those range of motion issues with your
right,
baby and have
right,
knowledge, so that if you don't have access to someone like you in your area, you
right,
at least have that empowered knowledge of knowing what it is
right,
that's going on,
right.
so that you don't get
There's something wrong with these joints. What do I see to fix that? Yeah,
yeah. And that, like we were talking earlier, the medical establishment doesn't necessarily recognize a lot of that, and what they think, or like what is classified as normal, has kind of evolved to
yeah,
accommodate for the number of interventions that are going on at,
yeah,
at the level of birth and labor, where it actually, like in the bigger picture of humanity, is maybe not
yeah. It's
not best.
unprecedented.
Unhealthy, I think that was the word you used. Yeah. Well, so I wish that we had more time, because I really enjoy interviewing you, and I want to bring you back on at some point. But it is time to wrap things up for right now. And is there anything else that you'd like to share before we close this session?
Yeah, I know I mentioned the crawling piece. Um, and that's really important, but there's a super easy test that you can do at home to assess the tone of your infant at 6 months. Usually really healthy babies can do this successfully at 4 months, but by 6 months they should definitely be able to do this, where it's a pull to sit test. The infant is lying on their back, and you're making faces at them, and you grab both of their hands and you gently pull them up. And if that cranium comes up the way we do if we sit up, like we bring our head often first, if not flush, but it doesn't do this as we sit up. There's no lag in the head. And that test is so basic, but so fundamental. And I'm finding that not a lot of childcare workers, even in the medical system, are doing this. Often it doesn't get done until 10, 11 months. And that's a sign that there's a significant increased risk for autism spectrum development. And the sooner you catch that, the easier it is to subvert it. The easier it is to fix and address that. And you can see, a developmental neurologist to confirm those findings. And you can hopefully find a CST or a nerdy chiropractor like myself. But that test is something that, like, I feel like everyone should know, and everyone should be doing that, because if you have that lag at 6 months or 7 or 8 months, like, bring that child in right away, like, get an early intervention. That's probably one of the simplest and most underutilized and undershared things that I could possibly offer for families of new babies. It's
Well,
a,
we need to get
it's a
you
big
your own
deal,
YouTube
and it's
channel.
What was that?
You need to get your own YouTube channel.
I should just start running my mouth.
Everywhere.
Little, it's nice to do. It's nice to do just to give parents like little things that they can do at home. Because if that, that's one of those things where I just want to just kick something when that gets missed for a couple of years, then there's a huge opportunity that was lost to bring that child's brain right back to where we'd like it. So I hope that it comes back and that more mainstream, like both parents, also educators, also obviously by the time early intervention gets there, they know what they're doing. But if you don't know to call them, or if nobody gets referred that way, then that's just a bummer. It's too bad. So pull to sit, easy.
Okay.
And you don't, obviously, if they're coming off the floor like this, you don't need to pull them all the way up. If they haven't engaged as their shoulders come forward, there's no need to make their neck do this.
Okay.
You can try a couple of different times. You can do all sorts of variations on it. Don't panic that week. Try it again 2 weeks later. Bring her to the pediatrician. This seems weird, and then you're off to the races.
Okay. And the age
6 months. 6
right
months.
at 6 months.
Yep, by 8 months, usually before 6 months, but by 6 months, it's an issue. It's a flag. It's an orange flag.
All right. Well, thanks for joining us. People can check below. I will put Dr. Erin's contact information underneath this link here, underneath the video, I mean.
Perfect.
And yeah.
Thank you so much for having me. This is great. I'm super passionate about this work, and I'm also going to be doing some outreach through videos and whatnot to try to speak with parents and find out what they want to know most, like what format. Is it a 3-minute video? Is it a couple 5-minute videos, or is it like 125? Those types of things, because I just have so much that I just want to put out there and get feedback on. So yeah, if you are interested, follow us on Facebook and or check website and get on our email list, and then we can work together to just get this information out there, because it's not rocket science. It's very basic stuff, and it's fun. And we make it fun. So
and how do you want people to provide their answer to that question about the length of videos?
I think what I will do is I will have a survey that I put up on Facebook, and I might email it as well. So if you're either on the list or if you're on Facebook, then you'll find that. I'll probably boost it to make sure most of the people that follow us actually see it. And then there probably will be boxes checked. It'll be fairly simple.
Okay, cool.
Options, and yeah.
Awesome.
Sweet.
All right. Well, that's a wrap for today. So thank you. On the horizon, we have the Be Love Family Festival. It'll be held October 5th at Rail Yard Apothecary. And we've sort of like come up with some of our main, what I'm calling the 4 pillars for birth and family. And those are holistic health and wellness. So Dr. Erin Sepic, as well as the majority of the other people who I'm interviewing on LunaSpeaks, and environmental sustainability, social justice, and community building. So you can find those 4 things at Be Love this year, and stay tuned for details. Thank you, Erin. See you next time.
Thank you so much.